already recovered. Our next guest has been advocating for safer conditions inside the Cook County Jail. Alexa Van Brent is the director of the MacArthur Justice Center at Northwestern University, joining us this morning via FaceTime. Alexa, appreciate your time.
Of course. Thanks for having me.
You know, Sheriff Dart has defended the current jail infection rates by noting, look, he's doing a high level of testing. He said, if you don't test, your numbers look great. They look like zero. Is any of this a notion of no good deed goes unpunished, meaning he's trying to get testing done and he knows more accurately the environment he's dealing with?
Actually, that statement is false. We know that the testing rate in the jail is incredibly, incredibly low. And we know that because he has about an 80% positive rate. And officials with the WHO have said, if you have an 80% positive rate, you are not doing enough testing. And that's indicated by his prior numbers of how many people have been tested as well. So actually, the numbers that are being put out by the sheriff deeply underreport the spread of the disease in that jail right now.
And of course, we know at this point over 600 detainees, correctional officers, other sheriff department employees have been infected. He's not going unchecked. I mean, this is before Judge Matthew Cannelli, who is making some rulings here and dealing with the situation. My question is, what ground rules do you think need to be put into effect, given the fact that it's not as though he has hotels to send people to or various other places? He's dealing with limited space to keep these folks in.
Right, exactly, which is why we went to federal court and said, you need to release people so that the jail can socially distance and protect the lives of the people who are inside. Right now, the jail cannot implement the CDC guidelines for social distancing at the capacity it has. The sheriff has admitted this. He filed a brief Friday night saying he could not socially distance. So we need the federal court to step in, and that's what we've asked the court to do, and release and transfer people, especially all the medically vulnerable people who are in the jail right now and highly susceptible to COVID.
The sheriff says he is moving nonviolent offenders out of the system, but that leaves him about 70% of the inmates who are, one would describe as the more dangerous offenders. I mean, we have to have humanity in this situation, no question about that, but you're not exactly, or he's not exactly dealing with an atmosphere that is full of trust and close relationships. So he's got special challenges.
Sure, but I would really push back against the sheriff's assertion that 70% plus people in the jail are violent. Many are in on cash bonds they can't afford to pay. If they are wealthier, they would be out. And we know from speaking to detainees over and over again over the last weeks that people are in there on charges, they're not murder. And they're not sexual assault charges. They're people who are presumptively innocent, have not had their day in court, and certainly do not deserve a death sentence because they can't pay to be released. And we also concur that the judge should consider public safety in releasing people. That is actually part of the release process under federal law, is a public safety balancing. So this is not going to be some willy-nilly open the gates process. It's going to be ordered. The judge is very, very invested in the suit. So I think the sheriff's points are a little bit more fear-mongering than they are based in reality.
Well, inmates have taken to a hunger strike, although it's being reported they're eating commissary foods, maybe just not the food they're being given, so not exactly a complete hunger strike. Is this just to get a message out, kind of the use of social media for people to know?
Right. I mean, they're getting a message out that they're stuck in the #1 hotspot in the country for coronavirus, and they're scared, and they don't feel like their rights are being protected. We hear from family members, detainees, all the time that they don't know what to do. They are stuck on a tier that is in dorms, and they can't socially distance, and they're sharing bathrooms, and they're sharing the single microwave for an entire deck of people, and they're scared. And people are symptomatic and not being tested. So hunger strike strikes me, no pun intended, as a really, understandable way to get attention at what's going on behind closed doors in that jail.
And before we run out of time, I do want to ask, when they are diagnosed or they come down with COVID, I'm sure, what kind of treatment are they getting? Are they being treated like any other patient would in the public, ventilators needed and that kind of thing?
Yeah, we do. We don't have a ton of data on that. We do know that people who are very sick and need ventilators are transferred to Stroger Hospital. We also know that some detainees are being hospitalized in-house at Cermak, which is the jail's hospital. We don't exactly know at this point in the litigation what the capacity is of CIRMAC to treat very sick people, and we actually want to know more about what CIRMAC is doing for those people. But there have been detainee transfers to Stroger for ICU care.
All right, Alexa Van Brent with MacArthur Justice Center. Thanks so much for your time, clarifying some issues perhaps the sheriff's watching. Thank you.
Thank you. Take care.
You too. Coming up next, was the governor's decision to forge ahead with Illinois' election worth it? We got the final turnout numbers for the March primary when we come back.